Welcome back, everybody. I have the largest panel, and it could have been bigger. Anyway, good morning, everybody. I'm Lorelei DeSogra from United Fresh Produce Association, and I just want to say thank you all for being here. As a member of the planning committee, this is just like so exciting to finally see this happen. And thank you to everybody that really worked so hard to bring this about. My panel, I call my panelists the Brain Trust, and I mean that. They're just phenomenal, the work that they've been doing and what they're going to share with you today. So this is, I think Alan labeled this the nuts and bolts panel. But this is really how to, we're going to be looking at 4 very, very large incentive programs. One national, Wholesome Wave, and Sky's going to do that. Then we're going to be looking at New York City, Minnesota, and Michigan. Each of these programs are multifaceted, and they're trying to jam everything into their 5 slides. We also have we have enough time at the end for a lot of questions and answers. So let everybody know that we've got at least 30 minutes, and I'm sure there's going to be a lot of questions. So you're going to hear me introduce my Brain Trust. And you've got the longer bios in your packages, so I've kind of shortened this to speed this up. First, Sky Cornell. Sky is the Vice President of Programs for Wholesome Wave. She's responsible for the national strategy and for operations of the Double Value Coupon Program, a network of nutrition incentive programs operated at farmers markets across the country. In the past 4 years, she's played a leadership role in scaling up double value coupon programs to 25 states and over 300 sites. Wow. Kathy Nonis is next. Kathy directs the New York City Health Department's Physical Education and Nutrition Program, where she works on policy initiatives including access to healthy foods in underserved neighborhoods. She has been instrumental in New York City's Green Cart initiative. Everybody's heard about that, the mobile vendors selling fresh fruits and vegetables in food deserts. New York City's going to have a joint presentation, so joining Kathy is going to be Alexis Stevens, and Alexis is the manager of Grow New York City's Best, EBT project, and other food access initiatives for green market farmers markets. She has over 10 years of experience working on local food access projects. Now moving to the Midwest, northern Midwest, to Minnesota. And again, Minnesota, we have 2 speakers. Tiki Brown, let me do them in the order that they're sitting, so let me jump, sorry. Sue Latrobe is the Health Improvement Project Manager for Prevention at Blue Cross Blue Shield of Minnesota. The center is committed to improving the health of all Minnesotans by tackling the leading causes of preventable death and disease, building vibrant communities where healthy choices are easy and more accessible. And their funding, which I thought was very interesting, is from a historic lawsuit against the tobacco industry. So this will be interesting. And joining Sue is Tiki Brown. And Tiki is the Food and Nutrition Program Supervisor for the Minnesota Department of Health Human Services, Office of Economic Opportunity, where she oversees a variety of programs including SNAP Outreach, SNAP Ed, and incentive programs including farmers markets and the EBT Transfer Initiative. She is focused on community collaboration and working on food access issues for low-income Minnesotans. And then now jumping over to my friends from Michigan. So much is going on in Michigan. You guys are going to have a hard time cramming this into 10 minutes. But I know we have Michigan speakers later on, too. So let's see. First, we have Drew Montre. Thanks for being here, Drew. Is the founding director of the Michigan Farmers Market Association. She leads Michigan's efforts to bring together a diverse group of stakeholders focused on increasing access to healthy foods through farmers markets, and is proud of the work they've done today, increasing the number of farmers markets accepting SNAP from 3 markets in 2006 to 150 today. Wow. And last but not least is Rachel Ware. And Rachel directs Fair Food Network's Double Up Food Bucks program. And I want to personally thank Rachel for the great tour I had last year. And when I went to visit the farmers market, Eastern Market, and 2 of the retail stores that you were doing pilots in. So thank you so much. She managed the growth of the program from a 5-market pilot in Detroit, 5-market farmers market pilot in Detroit, to a statewide demonstration throughout Michigan, and now coordinates several special projects to test new technologies for mobile EBT processing and Double Up Food Bucks in grocery stores in Michigan. Last summer, there were 3 independent stores in Detroit, and this year they're going to be expanding to Spartan, which is a regional chain in Michigan. So hopefully she'll get some questions about that expansion. Okay, turning it over first to Wholesome Wave and to Sky. Thank you.
Thank you, Lorelei. Can everyone hear me okay? Okay, wonderful. Okay, so I love kicking off this panel because Lorelei discussed all of the great in-depth information that you're going to get in a few minutes, and my job is to discuss some of the other diversity amongst practitioners in the field. So we couldn't have this be a 20-person panel, so I get 10 minutes to talk about some of the other things that are happening across the country. First, I'll start with a definition. So what is the Double Value Coupon Program? Excuse me. I'm about 6 months along, and I forget that I have to take deeper breaths when I start. So if you hear me slow down for a minute, that's why. So our program, it's really a network of practitioners. It's not one single program across the country, and hence the diversity there. So we'll be talking about over 300, it's farmers markets, CSAs, mobile markets. Thank you to Pam for doing an incredible job of sharing that information about the mobile market earlier, as well as farm stands. And partners are very diverse as well. In addition to nonprofit organizations, there's community health organizations, local public agencies, as well as producer associations who are all part of the practitioner groups that are implementing nutrition incentives. So I'm going to spend, since I have 5 slides, I'm going to spend the first 3 slides talking about the diversity of the programs, and then the last 2 pointing to some of the ways that we've been looking at consistency across the program. So things like data collection and evaluation, as well as focusing on what are some of the other key elements, such as capacity building, that are very important to consistency, and then where can we find other possible ways of building consistency. But I think you'll hear more about that from some of these groups. First, we thought we'd look at the types of incentive programs. So size. Between 10,000 and 50,000 in both federal benefit sales and nutrition incentives is about the average of the 60 practitioners that we're working with. There are some smaller groups. I think that's supposed to say under 10,000 right there, and also some larger that are doing over 100,000 a year in sales and in nutrition incentives. This is often driven by the size of the program. So about half of the groups that we work with are smaller networks, between 2 and 10 sites in the network. The remainder is built out pretty evenly between single sites and large networks, which is over 11 sites in the network. And then program location. So we've taken a look at what's the diversity in urban and rural locations. A little over half of the groups that we're working with are in urban locations, about 57%. The remainder are rural or a combination. A few are a fantastic combination of urban and rural. Finally, we really wanted to share what are some of the different elements of the diversity and innovation across incentive programs. Over the 5 to 7 years, we've been working with some groups a little less, some a little longer, but over 5 to 7 years, we've really worked to refine the types of incentive programs and the key elements to the incentive programs. So I think many of you have probably read the Farmers Market Incentive Program report that Westat prepared for the USDA, one that came out earlier this year, and they spoke about the maturity of incentive programs and about 3 years being kind of the key for refinements for those programs. And that also has matched to our experience as well nationally. Groups have refined their programs based on several different criteria. Generally, I think we heard the first panel touch on it, budget is a big driver in refining the program. As well, practitioners are looking at feedback from federal benefit consumers, feedback and input from the vendors and farmers, which is critical, as well as their own administration capacity to implement the program on the ground. So I won't go through everything here. I'm sure you can read through it, but some of the different elements, key elements, are federal benefits matched. I think we're going to focus on SNAP today, but you will hear discussion about other federal benefits such as FMNP or WIC CVV. Incentive levels, again, we're going to hear several different incentive levels, I think, in this panel. The vast majority of the practitioners in the Double Value Coupon Program Network are doing a one-to-one match for a variety of reasons, including kind of the ease in communication and how that drives people, more consumers to the markets. However, there are some great examples, such as what you'll hear from New York on the 40% match. There's also different caps, either per market day, sometimes per market week, per month, and different eligibility and enrollment requirements. I'd love to talk now, backing a little bit away from the diversity, to talk about the types of consistent evaluation that we've seen throughout this network. I have to say, many people in this room are partners, and thank you so much for your dedication to evaluation over the years. I know we all know that that's not an easy layer when you're already trying to implement a program, and yet this practitioner group has been very dedicated to ensuring that we can both refine programs and show the impact of the program. So standard data has been market level data, consumer surveys, vendor surveys, and market manager surveys. So market level data is what you would probably expect: the amount of federal benefit sales, incentive sales, the number of consumers. Consumer surveys, we focus more on information like, are you satisfied with the program? What drew you here today? And about fruit and vegetable consumption. And consistently over several years, we've seen that there's been a 90% increase or around that high 80s, low 90% increase of consumers who participated in the survey reporting that they increased their fruit and vegetable consumption. As well, we've participated in a few other studies. The diet and shopping behavior study, which is in the Wholesome Wave packets out on the table there if you're interested. That was a study that happened in 2011, 2012, and it took place in Massachusetts, New York, and sites in California. And although there was a lot of broad information, since I only have 10 minutes, I'll just share that similar to what Martin said about looking out at the tail of such incentive programs. We did see that when both adults and children participated in the program, they had a significant increase in their vegetable consumption. And then even 8 weeks out, so looking 2 months out, that significant increase in vegetable consumption remained among those. This was even after the program ended. So we think that's a great indicator of the types of longitudinal opportunities for this program. And finally, the cluster evaluation. We were fortunate to partner with Fair Food Network, Ecology Center, with Market Umbrella, and with Roots of Change on this evaluation. It's in your reading list, so I'll assume you've all read it or will have read it. It's a great study, and Ricardo will be speaking to it later on in the day. But what we found was that despite diverse and innovative different programs across the country, we really gathered similar data and found similar impacts from both consumers and looking at vendors and beyond. So finally, just a quick slide on the different elements of the network. And these are the kinds of elements that are very important in bringing together, we think, a diverse network. Again, referencing that study put out by Westat earlier this year, we saw that a lot of this information was repeated. A lot of this information was bubbled to the top, I would say, in that study about kind of the benefits of capacity building, such as with program design and implementation, as well as then moving into strategies for growth and expansion as the programs matured. Also, having a learning community and sharing best practices has been very important. I already mentioned the data collection and evaluation, as well as policy advocacy around capacity building. So, very excited to share some of those diversities among this network, and looking forward now to hearing about some of the other detailed nuts and bolts. Thank you.
Good morning. I'm very happy to be here. I'm Kathy Nonis. I'm from the New York City Department of Health, so I'm going to kind of do the first two slides, and then Alexis from Grow NYC is going to do the last three. I do want to introduce Jenny Clapp, who's in the back of the room there, because you must know that we have a new administration. We're reorganizing. She, from now on, is taking over all of the physical activity and nutrition programs that we have, and I will be kind of moving around between divisions. So from now on, Jenny's going to come up here, but I probably have been there longer, so that's why I'm up here now. I also wanted to kind of give you more of an overview of what we do in terms of increasing healthy food. We have really four kind of food programs. One is large supermarkets, working obviously with trying to get supermarkets into low-income areas. We do, as Lorelei said, have a green cart, a mobile. We have 500 carts on the streets of underserved areas where they sell only fruits and vegetables. We have a Shop Healthy here, a huge bodega, and we have about 20,000 bodegas in New York City, and we've kind of cordoned off areas of 150,000 people per area, working with distributors, bodegas, green carts, markets, etc. And then we have our farmers markets incentive. So with that, I'm just going to tell you a little bit about it. Ours is a $2 coupon. You get a $2 coupon with every $5 you spend in SNAP at the farmer's market, or you just get a coupon through community-based organizations, which I'll tell you about in a second. We started in 2005 as a tiny little pilot with $3,000 that we kind of distributed to community-based organizations to get people to learn about the local farmers markets in their neighborhoods. And so on the back of the coupon, it would tell people where their nearest farmers market was. Over time, this has grown now. We have $600,000 last year, and we're hoping to do better this year in distributing these $2 coupons. And we have 141 farmers markets now in New York City over these years, 59% in low-income areas. So this has really been a tremendous boon. And what you can see in the graph over here, well, you can't because it's because of the colors, but if you could see them, you would see that redemption has gotten higher and higher. And as you can imagine, redemption with SNAP, because you're spending your SNAP dollars at the farmer's market, is highest. But we really work with the community-based organizations to get their redemption high, and we do pretty well. So we're excited. Every year it gets even better. So what happens is we have three ways that we get our money. The funded SNAP incentive is really through the New York City Human Resource Administration, which has been very generous and every year has kind of upped the amount they've given us because it's been such a successful program. And again, customers receive this $2 health buck for every $5 they spend. We also distribute them to community-based organizations as incentives that are tied to nutrition programs. So they could be farmers market walks, they could be cooking classes, etc. And more, we're distributing them to programs at farmers markets and also CSAs, where they also have, like last year, Stellar Farmers Market reached 40,000 people, and we give them a coupon if they spend 25 minutes learning to cook a certain thing at the farmers market. So that's the kind of way in which we distribute it. And now I'll turn it over to Alexis.
Hi, everyone. So, as stated earlier, I work for Green Market Grow NYC, and why I'm here presenting with Kathy on Health Bucks is that we run 54 farmers markets throughout the 5 boroughs. 51 of those accept EBT, all of them accept Health Bucks. And the Green Market distribution for the Health Buck program was a little over $260,000 in 2013. So we represent a significant part of this program. So, how does this program affect New Yorkers and the local economy? Health Bucks has been a huge source of revenue for our local farmers. As Kathy said, we distributed $600,000 in 2013. That drove the sales for $841,000 in SNAP. And in total, in 2013, that's $1.4 million to regional farmers. This has been particularly important because the New York State FMMP program the funding has been cut annually for about the past 10 years. In New York State, this program is a huge part of the regional farmer income. I think it was, in 2004, totaled $4.6 million FMMP just in New York State alone, and in 2014 the funding is estimated at $3.9 million. So you can see that kind of Health Bucks is really making up for that loss in income. It increases the use, as many of you know, it increases the use of SNAP at farmers markets. There was a study done in 2010 on the effect of Health Bucks at farmers markets, and SNAP sales more than doubled at all the markets that we looked at. It also encourages customers to buy more fruits and vegetables. A CDC-funded evaluation in 2009 to 2011 found that 71% of Health Buck users purchased more fruits and vegetables when the Health Bucks were around. So administrative challenges. There are multiple incentive programs throughout New York City. We have Fresh Connect checks, which is similar to Health Bucks, where for every $5 you spend, you get a $2 coupon to spend on fruits and vegetables. However, it is mostly upstate, but some of these checks make its way to down into the city. Green Market also has its own program. We do Green Market Bucks that are year-round, where Health Bucks are actually just July through November. And we do have a type of Green Market Buck that can be used for everything at the market. So it kind of fills in the gaps where Health Bucks are not available to work, but we are just kind of working to streamline these programs and use Health Bucks wherever as possible, because we feel that it really makes these programs easier to understand for customers on what the coupons are, and for farmers on how to redeem them. And also streamlining and bringing all these programs together, make the programs less administratively burdensome, and less administrative funding having to be spent on these programs mean more money we can put into the coupons and in the hands of low-income individuals. So looking forward, what we plan on doing, what we're kind of working on right now, we really are looking, as stated previously in the panel, we're looking for more money. We really want to make this program year-round. It's so successful July through November. There's absolutely the demand there. We have the farmers markets that are open year-round. We just need the funding to have the coupons go year-round. We also are trying to get working, and it's going to probably take for a few years, out from this, but to get the Health Bucks program onto a mobile app. Green Market, Farmers Markets, we are currently, we were previously using we're using a Verifone terminal that many of you guys probably use at your markets. We're moving towards using iPad technology. We're encouraging our farmers to get iPads and use a mobile technology, and we'd really like this incentive, the Health Buck incentive, to be automatic. These $600,000 in coupons, that means actually 300,000 coupons. It's an incredible site, Kathy knows. It takes up an incredible amount of space. You have to track every single coupon and every single serial number. So having this all be electronic would also alleviate a lot of the administrative burden. And that's it. Thank you, guys.
Well, good morning, everyone. We are not the Minnesota Twins, but we think our track record might be a little bit better than our team might be a little bit better than that team. And we're not Michigan. They're a lot bigger and better than us, but we're trying. You know, we're like, we're a little bit above average, as they say in the Prairie Home. Okay, briefly, we have to share about 3 different healthy incentive projects that we have going on in Minnesota. One is a Fruit and Veggie RX program that we have in partnership with Wholesome Wave. Another is our SNAP Plus project that we did in 3 grocery stores. And then most of our time will be spent on the EBT Market Bucks Farmers Market Initiative that is funded through Blue Cross Blue Shield and in partnership and administered by the Department of Human Services. I just wanted to make the comment that Blue Cross is really interested in this work, of course, as a health plan, trying to improve the health of all Minnesotans, and we are interested in increasing fruit and vegetable consumption as it relates to the prevention of diet-related disease. Okay, let's see, I gotta move along, huh? I just want to briefly share, we just launched this, the Fruit and Vegetable RX program this spring. We are working with 2 clinics in Minnesota, one in a low-income neighborhood in North Minneapolis with diabetes patients. And they will be working with our farmers market there in North Minneapolis to redeem their prescriptions for fruits and vegetables. The second site is in a rural central Minnesota town of Melrose, and we're working with a grocery store where again, patients with diabetes will redeem their prescriptions at the grocery store. And I think it's one of the first in the nation, maybe, I don't know. I think so. We'd like to be, maybe we're second. Okay, and you can see the goals, and I just want to briefly mention that we are looking at patient outcomes, of course, the clinic outcomes and the retail outcomes. And again, Blue Cross is kind of interested, of course, in the health outcomes, but also in what the clinic experience is like with this particular project. And I'll turn over to my friend here, Kiki.
All right, so I'm going to talk a little bit about the Minnesota SNAP Plus retail incentive pilot that we did. The Department of Human Services received a USDA waiver to conduct a pilot for 6 months, and we worked with 3 small to medium-sized independent grocery stores. And what we did is no technology. We tried to keep it very low-key, and really it was really store-driven and cashier-driven. And what we did is customers could come in, and if they used their EBT card to buy at least $5 worth of fresh fruits and vegetables, they received a $5 coupon to use on their next fresh fruit and vegetable purchase. And surprisingly, we thought we'd see a lot of, okay, turn right back, go through the grocery store. We didn't see that. That's what I would have done. But the intent really was to increase the amount of fresh fruit and vegetable purchases, and we thought we would measure that through coupon redemption or the SNAP client participation. We worked really strongly with the Minnesota Grocers Association, and they were really key in helping us identify these independent grocery stores that served a low-income population, and as well as grocery stores that were really interested in serving their SNAP population and seeing they had some great community buy-in. We had 3,000 participants, and as you can see from our results, we had a very great coupon redemption, 8.5% versus an industry standard of 1 to 2%. And we increased the dollars, the $52,000 in fresh fruits and vegetables purchased by SNAP participants. The one thing we thought we would be able to see that we weren't able to see was a rise in the grocery stores fresh fruit and vegetable purchasing, but because our sample size was quite small, we didn't we weren't able to see that. So some of our challenges with that, we had some small-sized stores, and while that was a great benefit, they were really able to train their cashiers very well, and the cashiers actually changed their perception of SNAP customers, so that was sort of a plus. But the small-sized store it was a little bit of a cumbersome process because we didn't use the technology process. Clients did find that was a cumbersome and sort of a lengthy process, and they had to be really encouraged and incentivized to do so. And then one other piece that I think was a success was that we really did partner with the nutrition education program, SNAP Education, and we had SNAP Ed demos in the stores. And while anecdotally we saw the grocery carts go by with the fresh fruits and vegetables from the demos, I think people just bought that instead of buying their normal purchasing habits. So I'm going to move right along into the EBT Market Bucks program. So in Minnesota, the EBT Market Bucks incentive program began in 2010 with three farmers markets. And you can see on the bottom, it's again a $5 incentive. If people use their EBT card and for $5, they receive $5 of market bucks each day. We moved in 2014, we moved up to 62 market sites. And really, it evolved from several independent efforts into one sort of centralized administration model that we're doing. So DHS became involved in 2013, and our interest was really on increasing food access and serving the low-income populations in our state. These 62 market sites serve a really wide geographic spread across the state, quite a few rural markets, and then it's probably divided half and half between rural and urban. And the Department of Human Services, one of the reasons why we became central administrators, because we had that capacity to grow. We were able to turn around grants pretty quickly and expand the number of markets that were interested in this project. And then just real quickly, a couple successes, I think. One, we have a really strong technical assistance component to our markets. We found that the markets really need a lot of hand-holding, one-on-one assistance, and we do require that each market have an EBT booth, and our funding actually staffs EBT staff people at those booths during the market day and the times that they're open. Turn it back to Sue.
Okay, we wanted to share a little bit of results from last year, our 2013 results, and as you can see, we had kind of three primary goals. We had an evaluation conducted by an independent firm called Wilder Research, and we were looking at, what we've initially had the goal of universal acceptance of EBT at markets in Minnesota, and that's proven to be quite challenging, especially because we remain to be the sole funder. So we'll talk about challenges this afternoon. But we've had a modest growth over the last 5 years, and we feel that we have increased access to healthy foods in Minnesota through this program. You can see the total sales of over $230,000. That represents about 220% increase over last year. So it's while it's small numbers yet, it's still substantial growth for us. And of course, we like to see the increased purchase of and consumption of fruit and vegetables. I did want to point out a couple of things here, though. You'll see the percentage of the 76% of the people surveyed had felt that the price and the quality of the fruits and vegetables that they purchased were better or even less expensive than grocery stores that they were buying them. And that's really a significant thing to us, because we had heard from people who had a perceived barrier that prices at farmers markets were more expensive. And also the note, I put this in the study, out of the study, the willingness to try new fruits and vegetables. And as we know, I come from this from a human nutrition standpoint, and if you're expanding people's palate and their willingness to try new fruits and vegetables, they're more likely to consume a broader array of vegetables. So that was a really important piece for us. You'll see out in the table, there's an extraordinarily blue handout. Talk about blue branded. A little bit of a summary of our full report, just some brief highlights if you're interested. We will be also sharing that with the people here, the full report. As we're looking to 2014, we really wanted to do two things. One, we did very modest growth. You'll see that we've expanded from 49 to 62 sites in 2014. But we really wanted to step back and say we need to increase participation rates, particularly in greater Minnesota. And we also wanted to increase the rate of return. We have somewhere, we're estimating about a 23% rate of return where people are coming 2 or more times. So that's a goal. And as we step back and reflected on 2014, we kind of revamped our theory of change because we really want to make the change of people, purchasing and consuming more fruits and vegetables, and really came up with that there was 3 distinct strategies. We need to drive people to the markets. We need to have stability for the market business to be maintained, and we have to look at the big picture in terms of sustainability of the markets.
Right, so as Sue mentioned, we have these 3 strategies, and we really need these in order to scale up and increase the number of markets in our state and increase the number that we're working with. So the first one, utilization, it's really about the SNAP customers. And I'm going to move really quickly now. So we want people to be motivated to get to the market. We want there to be effective messaging, and in particular, as mentioned before, there's some confusion over the wide variety of different programs, incentive programs that are offered at the market. Availability means really working with the markets and vendors, understanding that it takes time, it's not going to happen overnight, and really this capacity building that farmers markets need, that lift on every single aspect. And then, of course, sustainability, making sure we have funding diversity. As much as we love Blue Cross, we'd like to be able to gather in other funders. And we'd like to look at a technology solution. So we want to lift the burden from the markets and the vendors and look at this sort of statewide systems approach in which there's a consistent consumer experience, there's widespread support and champions throughout the state that can support this, and that there's an active role in promotion on every level, and then, of course, that this is less expensive to make.
Good morning. It is a privilege to be here today to share Fair Food Network's statewide SNAP incentive program, Double Up Food Bucks, with you. I work as the director of the Michigan Farmers Market Association, and one of our 5 focal areas is increasing access to healthy foods through farmers markets. And so it's been a real natural partnership to work with Fair Food Network on their statewide SNAP incentive program, as we are working on the ground every day to provide training and technical assistance to farmers markets so that they're able to accept SNAP. And so before I get into kind of the nitty-gritty, I want to give you an overview of where Double Up Food Bucks has been, from my experience, kind of at a statewide level with the Michigan Farmers Market Association, but also at a local level. My husband and I farm. We sell at the Bath Farmers Market, which is a participating farmers market site, so we accept Double Up Food Bucks, and I chair that farmers market board, and so I get to see these programs at work from a lot of different levels. Over the last 5 years, Double Up Food Bucks has expanded from 5 farmers market sites in Detroit in 2009 to more than 150 sites last year, and that is primarily still at farmers market sites, but there's also more about that in a couple minutes, mobile markets, and the farm stand network. Most of At a statewide level, over the last 5 years, this means that more than 3 million pounds of healthy foods have been purchased by Michigan families, those families that are receiving SNAP. And for farmers, more than $5 million in produce sales has gone into the pockets of Michigan farmers. So let me talk through how this works in a farmer's market setting from my perspective as a farmer. Double Up Food Bucks provides a one-to-one match. There's actually 2 silver tokens that are worth $2, and just like many of your programs that are using centralized models, shopper can approach the community tent or the market tent. Like they normally would, they would swipe their SNAP card, talk to the market manager about how much they want to spend that day, and they would be able to match those benefits up to $20 in a market day with Double Up Food Bucks to spend on Michigan-grown fruits and vegetables. And so one of the points of contact that shopper, that family has, is the market manager or a volunteer or someone that is really familiar with that market space. And so their first introduction is someone that is, customer service oriented and makes that connection with them and can really welcome them to the market and help orient them on how they can use their SNAP benefits for SNAP eligible foods and how they can use their Double Up Food Bucks benefits for Michigan grown produce. That person then uses their, in most of our markets it's tokens, some there's still paper script. They shop the market like any other customer would. At our farmers market in Bath, we also accept debit and credit. So we have debit and credit tokens circulating. We have a lot of people that approach our market manager tent to also swipe their credit card, and they use those tokens throughout the market. And the person shops and they come directly to me as a farmer, where I then have the opportunity to talk to them about how they can use their benefits. And so for some of these families, we are seeing families at our market that have never shopped at the market before. And a farmer's market is a different experience than a grocery store. Sometimes it is alarming when you approach me and I'm like, how can I help you? Or what looks good to you today? And that type of conversation, I think, is unique. And it's also an opportunity where all of us as vendors get to kind of personalize those conversations, and we act as educators and trying to help people understand the different types of vegetables that we have and how they can use them. For me, it's a lot of times meeting people where they're at. And I am right next to a kettle corn vendor, and right next to them is a Mediterranean food preparer who makes this incredible homemade baklava. So I'm competing against, sweet, delicious snacks. But there's also the opportunity where I have, fresh shelling peas, and I have cherry tomatoes, and I have green beans, things that kids can pick up and eat. So we do allow sampling at our markets. I also have a 2-year-old and a 5-year-old who are perfect little salespeople. We have a lot of families, and so I'm able to tell people, this is what you can do with your kale today, or this is how you can add a green pepper into your meal. And I think those connections are really important as we're asking people to increase their purchases of fresh fruits and vegetables. They have an incentive, and they have someone helping them understand how they can use that. That education is so important. And they also have the ability to try it while they're at the market and purchase a little bit and take it home with them. So just like SNAP, if they don't spend all of their Double Up Food Bucks tokens in one day, they can then take them home with them. But unlike SNAP, if they don't use all their Double Up Food Bucks tokens, they can also use them at other participating markets. And so what's really incredible in our area, I think that because this is a statewide program, we have created stronger regional partnerships amongst our markets. I serve on the chair of our board, and we're working with other markets in our area. We cross-promote each other, and if people are looking for something that's not available at a smaller, more rural market like mine, they can go to the Meridian Township Farmers Market or the Lansing City Market and use those Double Up Food Bucks at markets all across the Lansing area. So As a vendor then, I simply just turn in my tokens like I do all of the other food assistance benefits that I accept. I get a reimbursement check from our township in 2 weeks, and it's a pretty simple and seamless process for both families and for farmers. Like I mentioned, this is the way it happens in the majority of markets still in Michigan, but there are 2 mobile payment pilots, one in Kent County and one in Flint that we'll touch on a little bit later. And while it's really easy for farmers and for families, it's also easy for farmers markets, although it does take a little bit more administrative support. It takes a little bit more time in terms of record keeping. But when we talk to market managers, that investment is worth it. So the beauty of Double Up is that it's a statewide program that's been created to work for markets of all different sizes, all different types in urban and rural communities. And when a market is set up and has the capacity to accept SNAP, then they can implement Double Up food bucks in a way that's low cost, there's a low administrative burden, and there's a high return for them. And I take my job with the Farmers Market Association in getting our next 150 farmers markets to the point where they're able to accept SNAP, so that as Double Up food bucks scales up, we can scale up to more farmers markets and to other types of retail outlets like grocery stores. So I'll turn it over to you.
All right. Great segue, Drew. Thank you. I'm Rachel Baer from Fair Food Network, and first I'd like to say that we are so fortunate in Michigan to have such a strong Farmers Market Association partner in MIFMA, and it's been great to be able to work with that network. But I'm here to talk about the grocery store pilot, which is a totally different thing. At the risk of being too obvious, I will just start by saying grocery stores are very different from farmers markets. So we started our grocery store pilot actually back in 2010 with a conversation with USDA to receive permission to implement our Double Up Food Bucks program in grocery stores. And then after a few more years of work, we actually launched that pilot on July 1st of 2013, just last year. We worked with 3 independent grocery stores in the city of Detroit. At the time we selected our stores, there were about 80 independent grocery stores within the city, full-service supermarkets, and no corporate chain supermarkets. Now there are 2 corporate chain supermarkets in the city. The stores we worked with are very different in size, in type, in neighborhood. They were Honeybee Market in southwest Detroit, Metro Foodland in the northwest area of the city, and Mike's Fresh Market on the east side of the city. We worked in partnership with Uplift Solutions out of Philadelphia. I believe Mike Basher will be here later this afternoon to talk about their role in the pilot. And we also worked in close partnership with AFPD, which is the trade association that represents independent grocery stores, gas stations, and convenience stores in Michigan, Indiana, and Ohio. So how it worked, the nuts and bolts of the process for a customer. Anytime the customer purchased at least $10 worth of any fresh produce using SNAP benefits, he or she would receive a $10 gift card. These were the store's basic gift cards, but they were branded Double Up Food Bucks. They looked like the card on the sign there. That gift card could be spent on any Michigan-grown fresh fruits and vegetables on any subsequent purchase. So that subsequent purchase could be right then, if the customer had $10 more of produce, or it could be on their next visit to the supermarket. For the store, that store needed to be sourcing and advertising, marking Michigan produce, identifying it for the customer. And they also needed to have their cashier staff prepared to be educating customers about the program and also filling out a small amount of paperwork at the transaction in order to keep records of the program for our evaluation and accountability. And the store management submitted weekly reporting so that we were tracking sales of produce, Michigan produce, Double Up Food Bucks purchases, etc. Our results are on a 2-pager that we brought with us. We actually brought 3 2-pagers because we just really like information at Fair Food Network. But it's the one that says a win for farmers and families in the subtitle. But just briefly, we know that about exactly 3,684 of those Double Up Food Bucks $10 gift cards were given to customers. That represents, of course, $36,840 worth of Double Up Food Bucks purchasing power, and just under $16,000 of that was actually redeemed for Michigan produce. That's a redemption rate of 43%, and if you actually look at the number of cards that were swiped, at least 78% of cards were swiped at least once, just not for their full value. And that 3684 also represents the number, not unique, of visitors, of customers who participated in the program. So this was a pilot sub-project of our statewide Double Up Food Bucks program, and what we were really trying to do was transfer some of the success that we had seen in our farmers market program into the grocery store setting. And some things worked, some things transfer very well, and some things are, just subject to that difference between the grocery store and the farmers market setting. The things that worked well were actually the local and regional sourcing. This was something we were a little bit skeptical about, but it did work. The stores were able to source Michigan produce in season. We required them to have at least 15 items. Most of them stocked, actually all of them stocked 22 items on average each week, distinct Michigan produce items. So that was very possible. They either went directly to the Eastern Market wholesale terminal to purchase, or they worked with their regular suppliers to mark which items were coming from Michigan sources. There's potential, we think, in scaling up this program that local can still be a strong element of even a program that's year-round in a place with weather like Michigan. It can be a part of a year-round program with an emphasis on local. Our communications and outreach did seem to work using similar channels to the farmers market. You'll hear more about our communications and outreach from Oren this afternoon, but that Double Up Food Bucks brand, the little carrot apple logo, did transfer from the farmers market into the grocery store setting as a recognizable symbol. And finally, the other thing that is really similar between the grocery store and the farmers market setting is the reliance on partnerships. It was our partnerships with AFPD, with Uplift Solutions. We're building stronger partnerships with the Detroit Economic Growth Corporation, Eastern Market, the Cooking Matters program, which is run out of our food bank in Detroit, and our Michigan Nutrition Network, which is our statewide SNAP Ed implementing agency. All of these strong partnerships helped bring the program to life. The things that we need to do a little bit more work on moving forward are just adapting to the different terrain of a grocery store. The key areas for improvement are on the communications and the in-store experience. As Undersecretary Concanon said this morning, there are a lot of ways to encourage the purchase of healthy fruits and vegetables in the retail setting, and I think we could capitalize on that research a lot more in order to really make the Michigan produce prominent, make the produce prominent in the grocery store setting, so that it's the thing that customers really want to buy and is convenient to buy. And the one-on-one piece that Drew explained that happens at the farmer's market, the interaction with the market manager and the farmer and the other customers there is more or less absent in the grocery store setting. And so working on how we can replicate that and bring that more high-touch experience to the grocery store, I think, would help. And we're also trying to tackle the technology. I kind of glazed over the technology at the beginning of this talk because we were very limited by the systems that the independent retailers were used and their capability for developing a streamlined and secure system for distributing and redeeming incentives. And so to address this, we've actually started a partnership with a regional corporate chain called Spartan Nash. And we'll be doing a reprise of the pilot in 3 grocery stores in Detroit, again, independent, using the same system, but also with a few stores outside of Detroit that are affiliated with Spartan Nash. And we'll use their corporate register system, which will allow us to do a more sophisticated method of distributing and redeeming those incentives that we hope will streamline the process, make it easier for customers, and better all around. And with that, I think we're moving on to questions. So thank you very much.